welcome back to Breaking Brad. My guest today is my friend Mackie. Mackie and I met how many years ago at this point?
Close to 4, 3 or
4
4
years
years
ago?
ago.
Yeah, so she's become a great friend. She works in an industry that I am fascinated with because I feel like there is so much opportunity and so little discussion. And I wanted to have her in today to talk about that industry. So, Mackie, please introduce yourself.
Awesome. Okay, well, this is so exciting. Like you said, we've been friends for years, and, I've been hearing you talk about this new podcast, and so I'm just super excited to be here. My name's Mackie Swan. I'm the CEO of a company called Woo More Play. We make organic sexual wellness products for women. Been in this industry for many years, and similar to you, I think I just saw a problem and realized how underserved, under-resourced, frankly, just, like, ignored and neglected the world of female sexuality is. So it's a really fun space to be in, but there's still a lot of work left to do, I think, to, like, properly represent women's needs and the needs of women's bodies in the space of sexual wellness.
So before you were in the corporate world, you were an advocate in the space. You spoke about this. You led groups. Talk more about that.
Totally. So I actually stumbled into the world of sexual wellness completely on accident. I started my career at a traditional advertising agency. Had studied media in college, really wanted to work in advertising. I thought that would be the thing I did for my entire life. And when I was in my mid 20s, I started volunteering for a nonprofit that, not to get too deep in the weeds, but it is kind of interesting. They were hired by fraternity and sororities in order to basically support their risk management efforts on college campuses. So, yeah, it was really smart. This nonprofit would send facilitators out to educate college students about alcohol consumption or substance abuse, like a whole slew of topics. And when I signed up to facilitate, I got assigned to the workshop on sexuality and dating. So I went through a pretty intensive training. And then as a 20 something, I was getting flown around different parts of the country to speak to groups of, 200 sorority women at a time about here's what it looks like to be in a safe and healthy relationship. Here's what it looks like to be able to communicate about your needs in a sexual experience. Here's what it looks like if you might have a friend or a sorority sister who is experiencing an unsafe or abusive relationship. So it was a very thorough workshop on basically how to have like healthy dating and intimacy as, an early 20 something woman. And that was such an eye-opening experience for me because I'm from Eugene, Oregon. It's very progressive. I had at the time what I believe was probably the best like sex ed that you could have in a public school system. It was pretty educational. I also was raised without any religion. So I missed the memo that we're supposed to be ashamed of sexuality. Like I never understood that. I didn't even really understand that that was a thing, frankly, until I got into this space. But my parents never made us feel ashamed about that, so I could easily walk into a room and talk about sex and have no personal qualms or embarrassment about it. So you can imagine when I'm giving this talk and this workshop to groups of young sorority women, like how jarring that was and how quickly I saw that my comfort navigating this area of life was really unique. Um, and I've told this story a bunch, but I think, like, the moment for me was I was giving this workshop at UC Berkeley, speaking to 21, 22-year-old women, very bright, like, very smart young women, and they were asking me questions that I felt like I probably asked when I was 11 or 12 years old. So it was just really startling to get those types of questions from otherwise, like, really bright, really impressive young women, and I kind of had this light bulb moment of, like, they've never had anybody to talk to about this before. Like, I'm this stranger who just introduced myself to them in front of the room 90 minutes ago or 2 hours ago, and this is the first time that they've really had the space to ask these questions. So, it was really in some ways, really disheartening, but I think on the other side of that, it was really motivating, and that was kind of when I think I really understood more deeply I'm in a unique position to talk about something that I'm really passionate about, and also to get into a space to try to, like, enact some change. Um, so yeah, very long-winded answer, but I went from volunteering to saying like, "Okay, I wanna figure out how to do this."
How to do what? So open up the conversation about female sexual health?
Open up the conversation, but I think more than that, like, what motivates me to do this work is helping individual women understand that they have agency in their own sexuality and in their own sexual experiences, right? I think that so many women grow up just conditioned in very small ways over many years to just see themselves as a prop,
Mm.
right? Like, there's so much messaging. Like, a lot of women think sex isn't done unless the man finishes. Whether or not she reaches orgasm is irrelevant to whether or not she thinks she's done,
Mhm.
right? And so I think that, like, that is really, like, my rub, no pun intended, is like, no, you have agency. Like,
Mhm.
you can make decisions. You can decide what works for you and what doesn't work for you. And that can be really life-changing and really transformative for a lot of women.
Male sexuality seems to be an open conversation.
Mhm.
People joke around about Viagra's and Cialis and Levitras and whatnot, like it's bar banter. They like pass each other pills as they're going home, like, hey, don't forget to take one of these, but before you go in the other room with her. Why is the conversation so different? Is it because society is conditioned? Is it because there's a little bit of shame? So, in your opinion, is it just how people have been raised that maybe hasn't shifted yet?
I think it's a bit of everything, right? I think it's a really complex problem that requires a complex answer that's probably, frankly, above my pay grade. But I think a lot of it has roots in religion and religious upbringings. I think a lot of it has roots in just, the puritanical history and foundation of our country. But there is a really stark difference in the way that we as a society and in our individual communities treat male sexuality versus female sexuality. I think that, boys and young men are rewarded for expressions of sexuality in many ways, right?
Mm.
It's the difference between being a player and being a slut. And I think that women are taught to be ashamed of being sexual beings, and I think that there are many ways in which women are policed for expressions of that. It's interesting because you asked what motivated me to get into this space, and it
Yeah.
was very much that background that I shared of women don't know how to talk about this, women don't know how to feel powerful in this conversation or in their own personal experiences. That was why I got into this space. Once I got in it, learning what I learned about the lack of innovation, the extremely toxic ingredients that are used in product that go inside women's bodies, the fact that so many conventional brands were made for men, by men, have not changed their formulations for who knows
Mhm.
how many years. Like, that's what motivates me today. And I think that I had so much ignorance, and a layperson who doesn't work in this industry wouldn't know so much ignorance about the lack of proper solutions on the market. And
Oversight.
again, if people aren't gonna talk about it, how would you ever know,
So,
right?
so we met while you were going through the FDA clearance process for
Mhm.
Woo,
Mhm.
and Woo went through the motions and the work and spent the money and did the time to actually get the FDA's blessing to put their product on the market, which is sadly not that common
Mhm.
with a lot of products out there. So, talk about what you have to deal with in terms of these competitors out there. It's essentially like the Wild West in the lube space because you've got pop up shops, you've got boutiques, you've got, mass retail stores. And if you just don't read the label carefully or you're not trained to read the label, it'll say like massage oil or
Mhm.
intimacy oil, but it's not actually for penetration, for intercourse. And these products are going inside women's bodies, which is a hotbed for it's a superhighway for infection to obviously very important organs.
What we do see a lot in this space, if you walk into your neighborhood adult store, that maybe that store or maybe that chain doesn't really have the knowledge or the oversight to
Mhm.
to want to make sure that all of the products they sell are FDA approved.
Yeah.
It is the wild, wild west. There's a lot of stuff in there where it's like maybe it hasn't gone through the appropriate safety testing. Maybe they're calling it a massage oil, but they know that all of their customers are using it internally as a lubricant.
Yeah.
But not just lubes. Like we also make toys, we make vibrators, we make devices for women's
Mhm.
pleasure. And historically, those have been classified as novelty items, right? So that means anybody, if it's a novelty item, that is the wild, wild
Yeah.
west. You can sell whatever you want with whatever materials. So it is really challenging. And again, I hate to sound like a broken record, but I think because it is a topic that people don't want to talk about, that that informs so many different aspects of this industry. I think part of it is regulation. I think part of it is the enforcement side. I think part of it is consumer behavior and comfort selecting these products. But you have to kind of talk about these issues in order to change them.
I think that the conversation became more open for men when Viagra came out. It was the first big ED drug. It was 1998, believe it or not. One of the biggest drug launches of all time, still to this day. But all of a sudden, there's this pill, and now there's senior citizens running down the beach with women in bikinis on commercials. And if you take this pill, you too can run down the beach with a woman in a bikini who's half your age. So apparently, that's all you need. One of the reasons why I started this show was that there weren't solutions for the problem that I had. I had a problem with a chronic infection. This is something that is a relatively common thing. It's not something that I recommend. It wasn't any fun. It was a 70% fatal bacteria. Innovation was so stalled in that space that I had to go find my solution. I had to reformulate it. I had to make my own product. And yes, it's great that it turned into a big company, but I wish that I didn't have to go through all that. I wish that the science had caught up to the problem that I was having. So the science is there in women's sexual health. There is just as much technology, there is just as much research for what they call female sexual arousal disorder, which is the women's equivalent of erectile dysfunction because there's really not that much difference. I mean, we all start out in the womb, the tissue goes one way or the other. Things like swelling, things like lubrication is sort of the equivalent of having an erection for men. But we've had over 25 products released since 1998, the release of Viagra for men's sexuality. We've had two in the women's space, and the first one came out 17 years after Viagra, and it was an antidepressant
Mhm.
for women who didn't desire. It was for hypoactive desire syndrome, which is a bit like the industry screaming, "We've got so many tools out there so that men can get it up. If you're not wanting it, if you don't have the enough desire to have sex, there must be something wrong with you." So, what does that say to women? That society, industry, marketing, commercials are saying, "He can get it up. He has all the tools. If you're not horny, you need antidepressants."
Even though we do have scientific data about arousal disorders in women, I think it is a much more physically, mentally, emotionally complex issue. And so I think that we've seen these like ad hoc kind of separate attempts to correct arousal issues in women when I believe it's like a much deeper, more complex, more dynamic problem that has to do with relationship dynamics and communication. And again, women's understanding of their own sexuality and comfort navigating their own sexuality that may, in some cases, be helped by like a pharmaceutical solution.
Mhm.
But I think it goes much, much farther than that.
I couldn't agree more. And I think one of the reasons why there's been so much conversation around men's sexuality has been the availability of solutions.
Mhm.
And I 100% agree, by the way, that obviously the male is a much simpler, I'll call it a system. The wind blows by just right and everything's just fine. Obviously, there's a lot more going on in terms of like the arousal portion of female sexuality. But in terms of the physiological portion, there are relatively simple solutions out
Mhm.
there. People just don't talk about them.
Mhm.
Like Viagra it's a vasodilator. You take a pill, it goes through your system, and the blood starts flowing, and all of a sudden you're a kickstand. Now, there are topical versions of Viagra or injectable versions of Viagra. There's actually a urethral pellet version of a similar drug, which of course sounds awful, I'm sure, to people out there. But there are some people who just can't take the pill because it goes through your lungs. It can cause, reduced lung pressure. It's actually used as a cardiac drug in a lot of situations. But for those people who couldn't take the pill, they came up with a solution that they called Caverject back in the day. So everybody can like pucker a little bit when I say this, but there is an injectable ED drug that you shoot right into the sausage and it just pops up. And the active ingredient is called alprostadil, which is a locally acting version of a vasodilator. And it works. And then there was a product out there called Muse. It's still in Europe. It was eliminated in 2024 from the US. That for people who didn't want to do the injection, they made like a plasticky suppository pellet that would go right in the urethra for men. And it would sort of bleed out. I bleed is a terrible term to use right now, but it would sort of elute out and it would cause local vasodilation the same way as Viagra does. There's randomized clinical trials over the past 20 years that when women apply this topically, the sexual satisfaction score can go up as much as 60%.
Mhm.
So I think one of the main symptoms of female sexual arousal disorder is also just discomfort during intercourse. So I
Mhm.
believe there are people who may have the desire component, but because they're either postmenopausal, because they don't lubricate as well, because the blood flow doesn't work for one reason or another as well, it's just uncomfortable.
And then that's kind of the chicken or the egg, right? Because
Yeah,
if you're in physical pain or discomfort during sex,
yeah,
are you going to want to have sex the next time your partner is trying to initiate it? Probably not,
yeah.
right? And so I think it just becomes a cycle of you're not enjoying the sex that you're having. It's at some level traumatic. And when I say traumatic, I mean physically traumatic. It's like consensual and loving and all of those things. If your body is hurting while you're having sex, that is going to make you have an aversion to it next time. So that's a lot of what I do in our work at Woo, and a lot of what I talk with my team about is just there is this weird stigma when it comes to using products, when it comes to using something like lube. It gets a little bit easier, I think, if there are women maybe who are menopausal or postmenopausal and have this clear mental connection to, okay, I went through menopause, my hormones changed, I don't produce as much lubrication naturally, it's time for me to get a lube and then I'm gonna feel good having sex again. It's a little bit easier to have that conversation in those instances.
Mhm,
But what a lot of people don't understand is like, first of all, how much lubrication your body produces is nothing to be ashamed about.
mhm.
Some women get really wet naturally, some women don't. None is better or worse than the other. We all have different bodies and they all have different systems, right? So there's that. But then also, vaginal dryness comes from so many everyday things. And antihistamine, like you pop a Benadryl, that's going to affect your blood flow. That's going to affect your level of dryness. If you're on SSRIs, that's going to affect your level of
But yeah, there's
dryness.
actually an SSRI-induced female sexual arousal disorder that's like becoming epidemic level. So,
It's
so many
huge.
people are on Zoloft and Prozacs and whatnot. They end up with FSAD. I mean, it feels like an entire indication in itself could be antidepressant-induced female sexual arousal
But think
disorder.
about this, it's like you're already and not even that, just where you are in your cycle, right? Like, where you are in your menstrual cycle has a really big impact on how lubricated you get
Mhm.
naturally. So, if you kind of connect these dots and say you're a woman on medication or who just experiences dryness more naturally, you're already embarrassed and ashamed trying to advocate for your own needs sexually. You already feel really uncomfortable navigating a sexual situation. You're probably not super comfortable saying, "Hey, I need some lube." In the context of a heterosexual experience or somebody dating more casually, the guy has this mindset of, okay, I don't want to bring lube because that means I'm not doing my job well because there's all this like toxic messaging around if she's not getting wet enough, then you're underperforming. It's like there's so many steps that have to go right for people to feel comfortable and confident and like get the products that they need to have good sex. So it is really complex, but I say all the time, I'm like, once people start using lube, they'll never stop. Like, it doesn't matter how much you get wet enough on your own, right? Like, it's gonna make sex so much better for so many reasons, but we are constantly fighting that stigma. And it really shows up among, like, younger people who think something's wrong with her or something's wrong with him, and I shouldn't need that, and it's like, it's not really about should or shouldn't, it's just about, like, if there's a really simple solution to have way better sex, then check it out.
Yeah, your stuff tastes like cupcakes too.
It's delicious.
Didn't you have a party once where they frosted donuts with it?
We did. We partnered with this really cool donut brand at events where we took these, like, gourmet donuts and we frosted them with our lube because it does taste like vanilla frosting.
I look at things because I ended up starting a biotech company sort of by accident, the way you fell backwards into into sexual wellness. I do look at market opportunity. The same number of women, according to statistics, have female sexual arousal disorder reported specifically as discomfort during intercourse as men do erectile dysfunction. So the fact that there's not like a slew of products out there for this massive market blows me away. It's like this massive, I mean, forget like the right thing to do because frankly it is, but it's also like why aren't people tapping into this massive multi-billion dollar so if a woman can go to an OB and say, I'm not enjoying sex as much anymore, the same way a guy can go to his doc and say, I'm having trouble getting it up, Wouldn't there be an opportunity for a product like that? Hey, why don't you try this topical FSAD drug? It's very low risk. I mean, are women still uncomfortable even bringing that up to their OB, even in private quarters behind like doctors' doors?
I would bet that those conversations are not happening as often as you think they are in a clinical setting. I think that when women are going to their OBGYN, it's for like an acute issue. They have VV, they have a yeast infection, it's for medical care during pregnancy, whatever it is. I don't think as many women are seeking like medical advice when it comes to sex is uncomfortable because so many women think that that's just the way that sex is. And of course, we're painting in a broad brush here, right? And
Of
there's like
course.
many different layers of this, but I think that that is what happens a lot of the time. And it's also an awareness thing. Everybody knows what Viagra is, everybody knows what Cialis is. Any guy who, at least in the United States, when he starts experiencing erectile dysfunction, is going to have the awareness of, oh, I know that there's a pill I can take for this. I've been seeing it on, TV commercials for decades. So they have the like awareness and the motivation to say, okay, I'm going to go to my doctor. I'm going to figure this out. A lot of women don't even know what female sexual arousal disorder is, that it exists, first of all. And second of all, that there is a pharmaceutical solution to that.
In terms of the stigma that you were talking about, such as, being dry at certain parts of your cycle, some people just get wetter than others. It's just a physiologic mechanism and everybody's different. We're just different human beings. Even the classification in FDA for a female lubricant is a tool to manage the medical condition of vaginal dryness. So it's been labeled since, I guess it would be the 1976, amendments to the device classification database in the FDA, that if you need this, there's a problem. And while I do applaud the fact that these products should be regulated because we don't want people just importing random ingredients from other countries that are untested, they could have like, fungus in them or something like that could end up infecting the female system. I think it is a disservice to call them tools for managing a problem rather than an opportunity to better a natural part of your life.
Yeah, it's the conversation of fixing something that's broken
Yeah.
versus enhancing something.
The requirements for getting an FDA clearance on one of these products, and this is where I encourage people out there to do a little bit more research on the products that they buy, look them up, make sure that they're made by, reputable brands, that they're using good ingredients, that their facilities have been inspected at least one time in the past couple of years. I mean, there's actually things you can look up and check on these things. I've seen companies out there that actually have FDA cleared products that say untrue things on them about the way that they were validated, about the way that they presented their data to the FDA. Like, unfortunately, because of there's when you go through a 510(k), which is the FDA process of getting a device cleared, it's called a 510(k) pre-market clearance. It's for random informational sake. There's a set of tests that you have to do, and every lubricant has to go through these tests. There's biocompatibility, there's, preservative efficacy testing, there's stability testing for shelf life. There's a whole lot of things that I could bore people with all day about. Um, Unfortunately, as of right now, at least 3 of them require the use of animals or animal cells, specifically like the rabbit irritation test, the guinea pig sensitization test, and the cytotoxicity test. As a CEO of a company that does things the right way is harder, by the way. The right way takes longer. It's also the way to win the war, though, instead of just a battle. How do you react when you see companies out there that are just throwing claims out there like never tested on animals, even though we get a 510(k), or FDA registered, which is my favorite stupid claim that people make? It's like anybody can register anything. I mean, a Band-Aid is an FDA registered product. So, how do you react to a company that just is flaunting the rules? And what do you think about the oversight agencies that are sort of letting them get away with it?
That is a complicated answer. I mean, in terms of just base level, what's my reaction? I try not to get too worked up about it. We do things the right way at Woo. I'm a believer in karma. I'm a believer in like, the long term, like keeping our side of the street clean, if you will. So we're committed to doing things the right way. And I believe that people who take shortcuts will pay for them eventually,
Mhm.
right? So I think that that's not something that I lose sleep over. I will say that it gets a little bit challenging when it comes to managing expectations or questions from our customers
Mhm.
or prospective customers, because it's really hard to provide all the context and all the background needed to answer that question. But people will often come to us, retailers, um, customers, like individuals will come to us and say, "Are your products vegan?" So my answer to that is we don't use any animal byproducts,
Mhm.
and we only do the absolute bare minimum amount of animal testing as explicitly required by the FDA.
Mhm.
You know this. I didn't know anything about this 10 years ago before I got into this space. I'm also not a scientist, but to dumb it down completely just for the layperson is the FDA says, "Okay, here's the checklist of all the things you have to do
Mhm.
in order to get your medical device cleared, and quote, approved to sell by the FDA."
Mhm.
We go down that checklist, we send all the data into the FDA, and then they give us the stamp of approval. On that checklist are the animal tests that you mentioned, the cytotoxicity, different types of safety testing,
Mhm.
which is what the FDA has said, okay, this is the criteria for for proving the safety and efficacy of this product.
Yep.
Shelf stability, all of that stuff. We abide by that checklist. It's the only way that you can get the proper regulatory clearance in this category in order to sell it on the market in the United States as a personal lubricant. Do I wish that we lived in a world where I could sell a safe, non-toxic personal lubricant for women without animal testing? Absolutely. Do I wish that we could do our lubricant products without animal testing? Absolutely. Unfortunately, that's just not the criteria as it exists today. And moreover, without getting too deep into the business side, like there's a reason that people take shortcuts. Getting FDA clearance, all of those required tests, you're paying labs tens of thousands of dollars.
Mhm.
It's 18 months of your time. It's consultant and regulatory fees. It's working with a formulator or a chemist to get that side of the product formulation right. So I can kind of dumb it down in that way, but then I also need to just go on to say it's extremely expensive, it's extremely time consuming, it's extremely resource intensive. And as an early stage brand, like you only have so many resources available to try to change the system, right? So it's like at this stage we stand by our products, we are doing them right, we are making sure they are FDA cleared when we sell them on the market. But I do hope that over time we will see that criteria begin to change and begin to use other methods that have been developed to prove like human safety without using animal testing.
So in Europe, the criteria that they use, and that list that Mackie was just talking about, which was stated very well, by the way, for a non-regulatory consultant, um, some of those requirements have actually been replaced with laboratory tests. You know, it's governed by or it's recommended by this international standards organization that's just referred to as ISO, and the US is behind in adopting sort of substitutes for the animal tests. Um, I find that frustrating as well. One of my favorite stories about the FDA is I did a human repeat insult patch test, and you know what that is from the cosmetic space. But for the people out there who think these are just nerdy acronyms, because they are, to be honest, you basically take your product, you put it on a volunteer who's willing, you know, to have it on there for like 8 straight days or 9 straight days. You cover it up with something like a Tegaderm, which is basically Saran wrap, and you see if the skin reacts. And then you measure the percentage of reaction, you measure the percentage of people that have that reaction. And we did like 54 humans and 400 applications of this product, and we had 0 reaction. And I took that to the FDA with one of my devices to replace the guinea pig sensitization test. And they said, sorry, go back and do the guinea pigs. Like, so you're telling me that these humans are less indicative of how a human's going to respond to this product than 3 guinea pigs. And I remember asking them why. And to be fair, even the people in the room at the FDA know it's crazy, but the answer is just because. And I swear, one of the biggest things that bothers me just in life is when the answer is just because. It's like you're talking to your parents when you're a kid. It's like because it's my house, my rules. But they're the judge, jury, and the executioner all in one. You don't have a choice. You can try to appeal it. Good luck. I see companies out there that put out like public statements. They're mad because the FDA is, you know, sending them warning letters. You can't do this. Like, we're going to take a stand. I was like, just good luck. Just stop. Just figure out a way to work together with them at this point. Because the FDA can't even modernize until Congress gives them the authority to. So even the FDA is hamstrung until Congress or the executive branch says you guys can now modernize yourself. Everything's just stuck in the old ways, and because is the answer so often.
It also just takes time, right? So it's partially like once we know the science is there, the political and regulatory change takes a really long time to be enacted, but also just developing the scientific method takes that time. Like
Yeah.
getting to the point of realizing that, hey, we have this viable solution to replace the guinea pig testing took how many years, right? Like it takes a really long time to like come up with a scientific solution and then send that into certain trials and clinical trials and have them run for long enough to capture enough data for it to be statistically relevant. Like these are very long-term projects and long-term questions that people are trying to answer. And then once you have that answer, it takes a whole hell of a lot of time to like disseminate into the world in a way that changes the criteria for brands like me to get products approved.
I personally have trouble with the notion of, I mean, let's just call it what it is. It's sexist.
Mhm.
It's sexist that if the man can get it up and there's so many pharmaceutical options, so we know he can at this point, and you don't want it, there's probably something wrong with you. So, I mean, it's a sexist. And I am like dying to go after the female sexual arousal disorder market. Like the second I am through like our lead drug programs that I can afford to go into that, like I'm all over that.
I'm so right there
Yeah.
with you, and there are products on the market today that are not pharmaceutical solutions, that are things that are more herbal or homeopathic
Mm.
or, over-the-counter solutions, that I think there is, anecdotal evidence that that may help some women marginally. I think that we've looked at this with woo and tried to come at it a few different ways. It's hard to find a solution that makes a meaningful difference for a large number of women in that space, where they're actually gonna notice a difference in their desire and in
Mhm.
their arousal, and also that doesn't give them, like, so much homework to do. Because what's great about Viagra and Cialis is you take a single pill, whereas a lot of these, like, over-the-counter solutions for women, it's like, "Okay, take 4 gummies a day every day, and in 6 weeks, you might be 5% more horny." It's
Yeah.
asking women to do a lot of work for very little payoff, right? And so I think that's, like, part of the downside too, is how much do we expect patients or consumers to do in order to experience the benefit? Because how great would it be if we lived in a world where women could have that, like, very straightforward, very affordable, very accessible, and very instantaneous solution?
I think the industry is missing a huge opportunity here, and I am befuddled, to use your word, as to why they are not going after this.
I don't have the full answer to that question. I think it's money, I think it's interest, I think it's stigma, I think it's sexism, I think it's all of those things. Um, I hope it changes. I hope it changes. And I hope that we normalize the conversation around women's sexuality in non-clinical settings and non-pharmaceutical spaces, because I think that when consumers and individuals are more comfortable asking these questions themselves and seeking support for, hey, if you're not reaching orgasm or sex has become uncomfortable for you or you're feeling disconnected from your sexuality, like there are places to have that dialogue and get that support and be able to ask vulnerable questions without judgment, that also makes it more comfortable to go to your doctor, right? So I think that there's so many different pieces of the puzzle that are gonna have to be put together in order to get to that world that you just described. I am hopeful that it'll happen in this lifetime, you know? I really am. At the end of the day, it's all people, right? It's like people making these decisions, individual people
Mhm.
making these decisions around advertising policy and what's okay and what's not okay. It's individual people who are deciding whether or not to invest in a company and fund their research and fund their product innovation. It's individual people who are sitting at a desk reviewing a 510(k) application for a product and
Yeah.
deciding if it meets the safety criteria. So even though there are these like systems that have these processes that inform how we work, it does come down to people. And if somebody is like very personally, fundamentally uncomfortable with the idea that women want to have sex and women want to enjoy sex, like that's going to color the work that they do.
I call the show Cures Unfiltered, and originally it was inspired by like what I said before, the fact that there was nothing that could help me. But I also feel like we need to cure the lack of conversation here.
Yeah.
Like it shouldn't be that people are hearing these things for the first time, and if they
Mhm.
are on this show, I'm glad you're hearing it, but I'm disheartened by the fact that it is the first time.
At the end of the day, all I want people to do is, like, feel comfortable talking about this in the context of their relationship. Maybe that's their relationship to to themselves. Maybe it's the relationship they have with their own sexuality. Maybe it's the relationship they have with their spouse or their partner or their girlfriend or their boyfriend or whomever. But if you can just talk about it in the privacy of your own home with the person that you go to bed with every night, that to me is a win.
That is a
I'm
win.
not saying like you need to be out there talking about the lube that you're using at the grocery store. I would love it if you did. But short of that, create a space where you feel supported and you feel supportive. And like, I think that the most beautiful relationships that I've been in have been ones where it's like, okay, we're really comfortable exploring together and learning about ourselves and learning about our own bodies and each other's bodies and like trying different things on for size and seeing what works. Right. And so that requires a level of confidence to like navigate those topics and discuss those topics that doesn't exist in every household or in every partnership.
This is not a newly researched subject. It is just sadly not talked about enough and not pursued enough by the industries that could serve it.
Absolutely. Sex does not need to hurt. And I would go so far as to say it should not hurt.
Yeah.
So if you are uncomfortable, if you're experiencing pain, that is not what we want for you. It may be as simple as using a lube. It may be that you have something else going on that requires a visit to your OBGYN or a visit to a pelvic floor therapist or whatever. There's like a whole slew of sexual health issues and medical concerns that women can face at different stages of life and men can face for the record at different stages of life.
Mhm.
So all that to say that if it's hurting, it doesn't have to be that way. And just take like a couple steps down the path to finding a solution and it could really change your life.
Thank you for coming.
Thank you so much for having me. This was great.